How to survive a heart attack alone. After 67 life-saving tips every senior must know. What if I told you that in the 5 minutes it takes to read this script, 12 seniors will have a heart attack and nearly half of them will be alone when it happens? I'm Dr. William Carson, and after 40 years as a cardiologist, I've heard the same devastating words too many times. I just didn't know what to do. The truth? 65% of heart attack deaths in people over 60 occur before they reach a hospital, often because crucial minutes were wasted in confusion or denial. But what if I told you that knowing just 7 specific actions could double your chances of survival? Today, I'm sharing the exact life-saving protocol that saved my patient Richard's life when he experienced a heart attack alone in his garden last summer. These aren't theoretical tips. They're the exact actions that could mean the difference between life and death. Welcome back to Life Advice for Older People, where we tackle the real challenges facing seniors today. I'm Dr. William Carson, and after 4 decades as a cardiologist specializing in geriatric heart care, I've witnessed firsthand how proper knowledge can be the difference between life and death. Heart attacks after 60 present unique challenges. Your symptoms may be different than those you've heard about. Your body responds differently to stress. And the truth that medical professionals rarely discuss: the protocol for surviving a heart attack when you're alone is significantly different than when you're with others. Today, I'm going to walk you through the exact 7-step protocol that I teach all my patients over 60. Why? Because when Richard, my 72-year-old patient, collapsed alone in his garden last summer, it was these exact steps that saved his life. Before we begin, understand that this information isn't meant to replace emergency medical care. It's designed to keep you alive until that care arrives. The reality is that many seniors live alone or spend significant time alone. And knowing exactly what to do in those critical first minutes can make all the difference. If you find this information valuable, please hit that like button and share it with someone you care about. You never know whose life you might save. And if you're new here, subscribe for more life-saving advice tailored specifically for seniors. Now let's get into these 7 critical steps that could save your life if you experience a heart attack while alone. Tip number 1. Recognize the unique warning signs in seniors. The first and most critical life-saving tip is to recognize the warning signs of a heart attack in seniors, because they're often not what you expect. Many of us grew up with the image of a heart attack as someone clutching their chest in severe pain. But for adults over 60, especially women, the symptoms can be dramatically different and much more subtle. In fact, according to the latest research from the American Heart Association, nearly 40% of seniors experiencing a heart attack never feel the classic crushing chest pain at all. Instead, they experience what medical professionals call atypical symptoms. But there's nothing atypical about them when it comes to seniors. Let me introduce you to Joyce, an 83-year-old patient of mine. Last year, she almost ignored the signs of a major heart attack because her only symptoms were sudden fatigue, mild dizziness, and what she described as feeling not quite right. No chest pain whatsoever. Fortunately, her neighbor recognized these subtle signs and called 911 immediately. Here are the senior-specific heart attack warning signs you must know. First, unusual fatigue or weakness that comes on suddenly. This isn't your normal tiredness. It's a profound, unexplained exhaustion that feels different. Second, shortness of breath, especially with minimal activity or even while resting. If you suddenly can't catch your breath walking to the mailbox when yesterday was no problem, pay attention. Third, unexpected sweating, especially if it's cold and clammy and not related to temperature or activity. Fourth, nausea, indigestion or discomfort in the upper abdomen. Many seniors mistake a heart attack for stomach problems. Fifth, lightheadedness, dizziness, or confusion. For seniors, sudden confusion can actually be the first and only sign of a heart attack. Sixth, unexplained pain or discomfort in areas other than the chest, like the jaw, neck, back, or either arm. And seventh, sleep disturbances or increasing fatigue in the days or week before. Research shows many seniors experience warning signs up to a week before a major heart attack. For women over 60, it's especially important to note that you're more likely to experience the less obvious symptoms, particularly fatigue, shortness of breath, and nausea. Have you ever experienced any of these symptoms and brushed them off? Let me know in the comments below. I want to be crystal clear. Recognizing these warning signs early and acting on them immediately is your first life-saving step. Many seniors delay seeking help because they're not experiencing the Hollywood heart attack symptoms they expect. This delay can be fatal. Trust your instincts. If something feels wrong, especially if you have several of these symptoms together, don't wait to see if they go away. As we move to the next tip, you'll learn exactly what to do if you recognize these warning signs when you're alone. Tip number 2. Call 911 immediately. Don't drive yourself. The second life-saving tip might seem obvious, but it's where many seniors make a critical mistake. Call 911 immediately. Do not drive yourself. I cannot emphasize this enough. The moment you suspect you're having a heart attack, your priority is to get emergency medical services activated as quickly as possible. Every minute counts. Let me share a sobering statistic. According to the American Heart Association, for every minute that passes without treatment during a heart attack, more heart muscle dies. After just 10 minutes, the damage may begin to become irreversible. After 30 minutes, significant permanent damage occurs. Now, why specifically should you not drive yourself? There are 3 critical reasons. First, driving diverts your energy and focus when your heart is already struggling. The stress of driving actually increases your heart's workload precisely when it needs less strain, not more. Second, if your condition worsens while driving, which can happen suddenly, you become a danger not only to yourself but to everyone else on the road. And third, this is what many people don't realize. When you call 911, treatment begin is the moment emergency responders arrive. Modern ambulances are essentially mobile emergency rooms. Paramedics can administer life-saving medications, perform CPR if needed, and use defibrillators. They also alert the hospital so a cardiac team is ready the moment you arrive. My patient Anthony, a fiercely independent 76-year-old, initially ignored this advice. When he felt chest discomfort and shortness of breath last year, he decided to drive himself to the hospital. Halfway there, he lost consciousness and crashed his car. Thankfully, another driver called 911, but this added precious minutes of delay and caused additional injuries. Anthony later told me, "Doc, that was the most foolish decision of my life. If you're alone when symptoms start, here's exactly what to do. First, stop whatever you're doing and sit or lie down in a comfortable position. Next, call 911 immediately. Even if you're not certain it's a heart attack, let the medical professionals make that determination. When speaking with the dispatcher, say clearly, 'I'm a senior experiencing possible heart attack symptoms.' This helps them prioritize your call. Then unlock your front door if you're able to. This ensures emergency responders can enter even if you become unconscious. Finally, if you have a medical alert device, use it in addition to calling 911. These devices often connect you to operators who can stay on the line until help arrives. What about calling a friend or family member instead of 911? While it might be tempting to call a loved one first, this creates delay. Call 911 first, then call family or neighbors if you're able. Have you considered what you would do if you experienced heart attack symptoms while alone? Share your thoughts in the comments. Remember, calling for professional help immediately isn't a sign of weakness or overreaction. It's the smart, decisive action that could save your life. As we'll discuss in the next tip, what you do in the minutes after making that call matters tremendously. Tip number 3. Take aspirin correctly. Timing and dosage matter. The third life-saving tip focuses on a simple medication that's likely already in your home, but how and when you take it makes all the difference. Take aspirin correctly. Timing and dosage matter. Aspirin is one of the most effective immediate treatments during a heart attack, but many seniors don't know the correct way to use it in an emergency. Why is aspirin so important? During most heart attacks, a blood clot forms in a coronary artery, blocking blood flow to part of your heart muscle. Aspirin works by preventing platelets in your blood from sticking together, which can help stop the clot from growing larger. Research published in the Journal of the American College of Cardiology shows that taking aspirin during a heart attack reduces mortality by up to 23%, but only if taken correctly. My patient Sylvia, age 68, remembered to take aspirin when she experienced heart attack symptoms, but she made 2 critical mistakes. She took it with a full glass of water, which delayed absorption, and she swallowed a regular aspirin whole, which also slows the effect. When we reviewed what happened later, she was shocked to learn the correct method. Here's exactly how to take aspirin correctly during a suspected heart attack. First, after calling 911, immediately take 325 milligrams of aspirin. That's typically 1 full-strength adult aspirin, or 481 milligram baby aspirins. Second, and this is crucial, don't swallow it whole. Instead, chew the aspirin thoroughly before swallowing. This allows the medication to enter your bloodstream much faster, in about 5 minutes versus 30 minutes when swallowed whole. Third, take the aspirin with just a tiny sip of water, only enough to help you swallow. Fourth, tell the 911 dispatcher and paramedics that you've taken aspirin, including the exact amount and time. Important cautions. If you have an aspirin allergy, a history of bleeding disorders, are taking blood thinners, or have been specifically advised by your doctor not to take aspirin, skip this step. Also, only use actual aspirin, not acetaminophen, Tylenol, ibuprofen, Advil, or other pain relievers, as these don't have the same blood-thinning effects. I recommend all my patients over 60 keep aspirin easily accessible in multiple locations: your purse or wallet, bedside table, kitchen, and car. In an emergency, you don't want to be searching through cabinets. Did you know about this chewing technique for aspirin during a heart attack? Let me know in the comments if this was new information for you. Remember, aspirin is not a substitute for emergency medical care. It's a supplementary measure while waiting for paramedics to arrive. The combination of prompt 911 calling and proper aspirin administration has saved countless lives, and it could save yours too. In our next tip, we'll cover what position you should place your body in while waiting for emergency responders, another factor that can significantly impact your chances of survival. Tip number 4. Position yourself for survival. Sitting versus lying down. The fourth life-saving tip might surprise you, as it contradicts what many people assume. Position yourself correctly while waiting for help. And contrary to popular belief, lying flat isn't always best. How you position your body during a heart attack can significantly affect how hard your heart has to work and how much oxygen it receives. For seniors, this can be particularly important as our cardiovascular systems are already under greater strain. Let me share what happened with my patient Carlos, age 77. When he experienced heart attack symptoms while alone, he remembered seeing a movie where someone having a heart attack was laid flat on the floor. He did the same, but this actually increased his difficulty breathing and put additional strain on his heart. When paramedics arrived, they immediately adjusted his position. So, what is the correct position? The answer depends on your specific symptoms. If you're experiencing shortness of breath, which is common in seniors during a heart attack, the ideal position is what medical professionals call high Fowler's position, sitting upright with your back well supported and knees either bent or straight. This position allows your lungs to expand more fully, reducing the workload on your heart and improving oxygen flow. If you're feeling lightheaded or dizzy, a slightly reclined position is better, sitting at approximately a 45-degree angle with your back and head supported. This helps maintain blood flow to your brain while not putting extra pressure on your heart. If you're experiencing nausea, another common heart attack symptom in seniors, sit upright and turn slightly to your left side. This position can help prevent aspiration if vomiting occurs. The key for all positions is to avoid unnecessary strain. Don't stand or walk around while waiting for emergency services, and ensure you're in a stable position where you won't fall if you become dizzy or lose consciousness. What about loosening tight clothing? This common advice is actually correct. Particularly loosen anything tight around your neck, chest, or waist to make breathing easier and reduce restriction on blood flow. Another important consideration is temperature. Heart attacks often cause cold sweats, and seniors are particularly vulnerable to temperature changes. If possible, cover yourself with a blanket if you feel cold, as shivering increases your heart's workload. Where should you position yourself in your home? Ideally, choose a location close to your unlocked front door where emergency responders can easily find you. If you live in a multi-level home and experience symptoms while upstairs, do not attempt to go downstairs. The exertion could worsen your condition. Instead, call 911 and tell them exactly where you are in the home. Have you thought about where in your home would be the best place to wait for emergency services? Share your thoughts in the comments below. Remember, these positioning strategies are temporary measures while waiting for professional help to arrive. They're designed to reduce strain on your heart during those critical waiting minutes, but they don't replace proper medical treatment. In our next tip, we'll discuss a technique that can help manage pain and anxiety during a heart attack, another factor that significantly impacts survival rates for seniors. Tip number 5, control your breathing, the 4-7-8 technique. The fifth life-saving tip addresses something that happens automatically but needs conscious control during a crisis. Control your breathing using the 4-7-8 technique to reduce heart strain and anxiety. When you're experiencing a heart attack, panic is a natural response. Your body floods with adrenaline, your heart rate increases, and your breathing becomes rapid and shallow. For seniors, this stress response can significantly worsen the heart's condition and reduce oxygen flow precisely when your heart muscle needs it most. My patient, Vivian, age 71, credits controlled breathing with helping her survive until paramedics arrived. When I felt the pressure in my chest, she told me, my first instinct was to panic, but I remembered the breathing technique you taught me. Focusing on my breath not only calmed me down but gave me something constructive to do while waiting for help. The 4-7-8 breathing technique, developed by Dr. Andrew Weil and supported by research in cardiovascular medicine, is simple but powerful. Here's how to perform it during a suspected heart attack. First, sit in a comfortable, supported position as discussed in our previous tip. Then, place the tip of your tongue against the ridge behind your upper front teeth and keep it there throughout the exercise. Next, exhale completely through your mouth, making a gentle whooshing sound. Now close your mouth and inhale quietly through your nose to a mental count of 4. Hold your breath for a count of 7. This might be difficult if you're experiencing shortness of breath. If so, hold for as long as is comfortable, even if it's just for a count of 2 or 3. Finally, exhale completely through your mouth to a count of 8, making that same whooshing sound. Repeat this cycle at least 4 times or continue until emergency services arrive. Why does this technique work? The extended exhale activates your parasympathetic nervous system, often called the rest and digest system, which counteracts the panic response. For seniors experiencing a heart attack, this can reduce heart rate, lower blood pressure slightly, and increase oxygen efficiency, all beneficial during a cardiac event. Research published in the Journal of Emergency Medicine shows that controlled breathing techniques can reduce pain perception by up to 28% during acute cardiac events. Even more importantly, reduced anxiety means less adrenaline surging through your system, which decreases the workload on your already stressed heart. Another benefit particularly relevant for seniors, focusing on your breathing provides a sense of control during a frightening situation, which can help you make better decisions and communicate more clearly with emergency responders when they arrive. Have you ever used breathing techniques during a stressful situation? Share your experience in the comments below. Remember, this breathing technique doesn't replace medical treatment, but it's a powerful complementary approach that can potentially extend your window of survival while waiting for professional help. It's also a tool you can begin using immediately, without any equipment or preparation. In our next tip, we'll discuss a controversial but potentially life-saving technique that you should only use in specific circumstances when experiencing a heart attack alone. Tip number 6, self-administer chest compressions if necessary. The 6th life-saving tip addresses an extreme situation that requires knowledge most people don't have: how to perform self-administered chest compressions if you begin to lose consciousness. I want to be absolutely clear. Traditional CPR cannot be performed on yourself. It's physically impossible to perform effective chest compressions on yourself while unconscious. However, there is a modified technique that can help in extreme situations when you're alone and feel yourself beginning to lose consciousness. This technique is controversial in medical circles, with some doctors hesitate to teach it. However, after 40 years of cardiology practice, I believe seniors should know all their options. My patient Samuel, age 74, used this technique when he felt himself blacking out during a heart attack while alone at his cabin. He later told me, "I was sure I was going to die, Doc. Trying this gave me a fighting chance until my neighbor heard me and called 911. Here's the modified self-compression technique. First, if you feel yourself beginning to lose consciousness while waiting for emergency services, immediately lie down on a hard surface, preferably the floor, not a bed or soft couch. Next, make a fist with one hand. Place the knuckle side of your fist in the center of your chest, directly over your breastbone, sternum. Use your other hand to push your fist forcefully against your chest, then release. The motion should compress your chest about 2 inches deep. Try to maintain a rhythm of about 100 compressions per minute. That's approximately the beat of the song Staying Alive by the Bee Gees, which is the same rhythm taught in CPR classes. Continue until help arrives or you regain more stable consciousness. Why might this work? Standard CPR works by manually pumping blood through the heart when it's not beating effectively. This modified technique can potentially provide some blood circulation if your heart goes into a dangerous rhythm. It is not as effective as proper CPR administered by someone else, but in a life or death situation when you're alone, it may help circulate blood to your brain and heart. Important cautions. This technique has risks, particularly for seniors with osteoporosis or previous rib fractures. It could potentially cause rib injury. However, in a situation where the alternative is death from cardiac arrest, most medical professionals agree that attempting this technique is reasonable. This is truly a last resort measure. Your primary focus should remain on calling 911, taking aspirin if appropriate, positioning yourself correctly, and using the breathing technique we discussed earlier. Have you ever learned CPR or other emergency techniques? Share your experience in the comments and let me know if you think more seniors should be taught emergency cardiac procedures. Remember, the ideal scenario is receiving professional medical help as quickly as possible. All these self-administered techniques are temporary bridges designed to extend your survival time until proper medical care arrives. In our final tip, we'll discuss critical information you need to prepare in advance. Something that could save precious minutes during an emergency. Tip number 7. Prepare in advance. Create a heart attack action plan. Our 7th and final life-saving tip may be the most important of all. Create a personalized heart attack action plan before you ever need it. The reality is that during a heart attack, your thinking becomes clouded. Pain, fear, and even the physiological effects of reduced blood flow to your brain can impair your decision-making abilities. For seniors, this cognitive impact can be even more pronounced. My patient Louise, age 79, credits her advice. In that moment of panic, she told me, having a plan I could follow without thinking made all the difference. Here's how to create your personal heart attack action plan. First, create an emergency medical information card. This should include your full name, age, medical conditions, current medications, allergies, emergency contacts, and your doctor's information. Keep one copy in your wallet and another prominently displayed in your home. Many seniors use their refrigerator door with a magnet. Second, place aspirin in strategic locations around your home and in your purse or wallet. Remember, it should be actual aspirin, not Tylenol or other pain relievers, and preferably the non-coated kind that can be chewed quickly. Third, program emergency contacts into your phone with ICE in case of emergency, before the name so first responders can easily find them. Many smartphones now have emergency medical ID features. Take the time to set this up. Fourth, consider a medical alert device, especially if you live alone. Modern options include pendant-style alerts and smartwatches with fall detection and emergency calling features. Fifth, clearly mark your house number so emergency vehicles can find your home quickly. Reflective numbers visible from the street can save critical minutes. 6. Practice your emergency response. Actually walk through the steps we've discussed, where you would sit, where your aspirin is located, how to unlock doors quickly. Muscle memory can take over when your thinking is impaired. Finally, have a conversation with family members or neighbors about your plan. If you live alone, consider arranging regular check-in calls with someone, especially if you have known heart issues. Review and update this plan every 6 months, or whenever your medications or health conditions change. One additional step that's particularly important for seniors, discuss with your doctor whether you should keep nitroglycerin at home. For those with diagnosed heart conditions, this prescription medication can dilate blood vessels and improve blood flow during a heart attack. Have you created an emergency plan for yourself or an elderly loved one? Share your experience or questions in the comments below. By preparing in advance, you're not living in fear. You're taking control of your health and significantly increasing your chances of survival if an emergency occurs. Let me tell you what happened to Richard, who I mentioned at the beginning of this video. At 72, Richard was an active gardener who lived alone after his wife passed away. One afternoon while working in his garden, he began experiencing what he later described as unusual fatigue and pressure in his upper back. Because we had previously discussed the warning signs specific to seniors, Richard recognized these as potential heart attack symptoms. Instead of brushing them off as gardening strain, he immediately stopped what he was doing and activated his plan. He called 911 first, then chewed an aspirin he kept in his pocket while sitting in an upright, supported position. He focused on his breathing using the 4-7-8 technique we discussed. Most importantly, he had unlocked his front gate that morning, a habit he developed as part of his heart attack action plan. Paramedics arrived within 12 minutes and immediately began treatment. At the hospital, doctors confirmed Richard was having a significant heart attack with a 95% blockage in his left anterior descending artery, often called the widowmaker. Because of his quick response and the steps he took while waiting for help, Richard suffered minimal heart damage. 6 months later, he was back in his garden with a few medication adjustments and a newfound appreciation for preparation. "I always thought if I had a heart attack, I'd know instantly," Richard told me during his follow-up. "But the symptoms were nothing like I expected. If we hadn't had that conversation about what to look for and what to do, I probably would have just sat down to rest, thinking I was tired. By the time I realized what was happening, it might have been too late." Richard's story isn't unusual. In my practice, I've seen countless seniors survive serious heart attacks with minimal damage because they knew exactly what to do in those critical first minutes. Now you know the 7 life-saving tips that could make all the difference if you experience a heart attack while alone. Remember, recognize the unique warning signs in seniors, call 911 immediately, take aspirin correctly, position yourself for survival, control your breathing, no self-administered chest compressions for extreme situations, and most importantly, prepare your heart attack action plan now before you need it. If you found this information valuable, please hit that like button and share this video with someone you care about. You might just save their life. Subscribe to our channel for more life-saving advice specifically designed for seniors. In the comments, let me know which of these tips surprised you the most, or if you have questions about creating your personal heart attack action plan. Remember, knowledge and preparation are your strongest weapons against heart disease. Until next time, this is Dr. William Carson wishing you heart-healthy days ahead.